Right, guys. So once I'm done with the session, I'll be able to share these slides with you as well. So it's going to be easy if you can come in the WhatsApp group. The link is here, the QR code. If you can see on the screen, just scan it and come in the WhatsApp group. Right, because I will be doing the Plab introduction and I'll be showing some important slides. If you would like to have the access of those slides, would be great if you can just come in the WhatsApp group. Yeah. We can email you as well, but it is easy to send in WhatsApp group. Yeah. And tell me in the chat box, so where are you joining us from? Which country at the moment you are in? So we have got Dr. Dhruv from India, Dr. Rishikesh from India as well. Okay. Dr. Aina from India, Dr. Samar from Saudi, Dr. Sumit from India. We have got Dr. Harriet from Ghana, Dr. Aziullah Melal from India, Dr. Ala from UAE, Dr. Sharon from UK, Tanveer from Abu Dhabi, Alia, UK, Shashank from India, Hemant from Scotland, Dr. Olav Lua from UK, Shruti from Kenya, Ahmad, Istanbul. Hi, Ahmad. I'll be traveling to Istanbul tomorrow. We have got a course from Monday, so I'll be there in Istanbul tomorrow night. Okay. Soham from India, Ahmad. We have got from UK, Pooja from Northern Ireland, Saria from UK, Dr. Nilangani from Wales, Nilu. Okay, that's a short name. That's good. And Dr. Kim from Korea, Dr. Nyok from South Sudan, Dr. Jennifer from Ghana. Great, 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 great. So I'll tell you, so what I'm going to do, I'll be doing the Plap introduction. That will take maybe roughly, I would say, an hour. It's a brief introduction, but to be honest, once you're done with this introduction, you will see it's going to be easy for you to do any history taking in Plap 2, right? And then I'll tell you what actually we do in Aspire Plap Academy. And if you are interested in joining our academy, what are the options we have got, right? So that's what I'm going to do. First, we'll do introduction. That will take an hour. And then I'll take a couple of, like, say, maybe 10 minutes explaining what we do in Aspire for Plab 2. And we have got some discount coupons and all. I'll be able to share those as well with you guys if you're interested in. Okay. Okay. So Dr. Ahmad is saying, I'm joining the course. Okay, perfect. So I'll be seeing you on Monday, Dr. Ahmad. Huh? Great. Dr. Ali, we have got from Saudi Arabia. Perfect, perfect, guys. Perfect. So we have got Dr. Shahid from the UK, Dr. Salma Begum from Bangladesh. Okay, great. So we have got doctors from all over the world now. We have got Dr. Dashwin from Malaysia. Great, doctor. Okay. Right. So just for the access of these slides, please, if you can come in the WhatsApp group, you can see the slide on the screen and there is a QR code. If you can just scan it, you'll be able to come in our WhatsApp group. We have got Dr. Aliona from Ireland, Dr. Aiduo from Nigeria. Great. Yes. Okay, guys, then let's begin, yeah? So if you've got any question during this session, what you can do is just keep putting it in the chat box, yeah? Because I'm recording this session as well. So later on, I know like some of you or your friends, those who are not able to join, they might be needing the recording. So we'll be able to send that also. Okay. So any question, just keep putting it in the chat box. All right, guys, let's begin. Yeah, introduction, Plab 2 UKMLA. So first of all, congratulations, those who have just passed Plab 2 a couple of days ago. So first part is done. Now it's the second part, Plab 2. Yeah, you're halfway through. So welcome to Aspire Academy. Yeah. And just want to tell you briefly. So myself, Ankur Garg. So most of the lectures you will see in the Aspire Academy taken by me, Ankur Garg, and another tutor, my friend, Dr. Nikhilesh, right? So what is Plab 2? What is Plab 2, right? So the thing is you have given so many exams in your life, yes? Because doctor's life is all about exams. Doesn't matter what's your age, what level you are in at the moment. Still, I mean, you will be giving exams all the time. So this Plab 2 is a bit different. Different than other exam, different your university exam, different than your Plab 1. It's a consultation exam. It's an OSCE exam. So what's going to happen in this OSCE exam? You'll have 16 station. You'll have 16 different patients. Now, a lot of people ask, these patients, are they real patients? Because, if you're appearing for MRCP basis, there you have got real patients. But what about Plab 2, UKMLA? Do we have real patients? The answer is no. We have got the professional simulators. So they are actually professional actors, right? So you'll have 16 actors, right, in the exam, and you'll be having the scenarios from all the fields. You have scenarios from history, like from medicine, from surgery, from gynae, from pediatrics, psychiatry. You'll have some counseling, some ethical, some examination scenarios. You'll have sim and prescription. So everything will be there in these 16 stations, right? Each station, with each patient, you will have 8 minutes. So the consultation in the UK are time bound. You might be thinking, why? I should have unlimited time with my patient, isn't it? But the thing is, even in reality, whenever you go to the GP, the consultations are time bound, right? So they are, I would say, preparing us from today itself. That's why you'll have 8 minutes to do your task. And they'll be giving a task outside so that you will be reading the task first, like what you're supposed to do in the cubicle. So they will be having a task. I'll show you what kind of task I'm talking about. So you'll have 1 minute and 30 seconds to read that task. So 1 minute 30 seconds outside the cubicle to read the task. Then you're gonna go in, you will have 8 minutes with the patient. So you can say in total, one station is going to take roughly 9 minutes and 30 seconds. That's how it's going to work. Okay. And you have got 16 station, but it's not very easy to talk continuously for that long time. So that's why what they have got, two rest stations as well. Again, rest station can be any station. Sometime for some candidate, it might be their first station as well. Obviously, nobody wants their first station as rest station, but it can happen in the exam. Okay, so in total, you will have 16 stations plus 2 rest stations. So in total, you can say we have got 18 stations in this exam. So the exam is roughly going to take 3 hours. Now, guys, tell me, is it easy for you to talk for 3 hours? I would say it's challenge. It's not going to be easy. It is not going to be easy. So make sure you do not get tired before the exam starts. What I mean by that, see, you will be called in the exam for, like, say, an hour before it starts, isn't it? So you will be they will be doing your photos. They will be giving a batch and everything. So what happened is in that way, they will be taking some time, 10-15 minutes. So that is the main thing. So what I've seen in that 1 hour, a lot of candidates, they start preparing and start practicing. And when the exam actually starts, they feel tired. So just be very careful. You don't do any of these things because 3 hours talking, it is not going to be easy. Okay. Right. So as I said, type of consultations are what you'll have history station, counseling station, ethical, examination, man, prescription, everything is going to be there. And in the exam nowadays, you may have tele or video consultations as well. And again, you will not have many tele or video. I would say maybe 1 or 2 tele or video consultation, meaning you will not have the patient in the room. The patient is going to be on the phone. Sometimes it's video, so there you'll have a screen in front of you and you'll be able to see the patient on the screen as well. So this is how it works. Okay. Now, so when you get the result, what is going to happen and how you are going to get the result. So that's very, very, very important. We need to know. So they will give you 2 sheets when they give you the results, what these 2 sheets are going to be looking like. So this is the first one. So each station is going to be divided into 3 headings. What are these things? You have got your data gathering, your history taking skills. Then you have got management, how you're going to manage your patient. And then you have got interpersonal skills, how you're talking to the patient, how you're making the patient comfortable. That's what comes under it, right? So each domain you have got 4 marks. So each station is of 12 marks roughly. Each station is of 12 marks. Okay, that's how it's going to work. 4 for data gathering, 4 for management, 4 for interpersonal skills. So total is 12. So what you need to do is to pass this exam, what you need to do. Number one, so you need to get above the average score. So you have got 16 station, 12 marks each. So in total, it is 192 score. That is the total score. Now you'll ask me, what is the score we need to pass this exam? So it is going to be different on different days. Like in Plab 1, every time when they give the result, what's going to happen? The passing score is different. Same in Plab 2, every day the passing score is different. But what we have seen recently and all, the passing score is roughly 50%. Roughly 50%. So I'd say if you get roughly 100 marks out of 192, most probably you're going to pass this exam. But that's one criteria only. What is second criteria? Second criteria, they just changed recently. I mean, after November 2024, I mean, 1 year ago roughly, they changed something in the criteria. So initially, they used to say you need to pass 10 out of 16 station. Initially, they used to say you need to pass 10 out of 16 station. But what they have done, they have just made some changes. They said, now we will tell you on everyday basis how many stations you need to pass. For some exams, you might have to pass only 9. For some, you might have to pass 10. For some, you might have to pass 11. So that is the change that they have made. But to be honest, I would say from last 1 year, things are better. What we have observed, the candidate who has passed 10 station, they managed to pass the exam. The candidate, those who haven't passed 9 station, most of the time, they also managed to pass the exam. So I would say this new criteria of the exam is actually much better. Okay, so that's the thing. So you need to pass a certain number of stations on that day, and you need to get above the average score. That's how you're gonna pass. And they will give you this one sheet when they give you the result, and they'll tell you how much you got for data gathering, how much for management, how much for IPS, and what's the total score you got, and what is the total score was required to pass that particular station. That's how it's gonna be. Okay. Then if you go further, they actually mark us in this exam, they are marking us on these skill areas. They're marking us on our consultation skills. They're marking us on diagnosis, examination, findings, issues, language, listening, management, rapport, and time. So these are the things that they are marking us on. So let's talk a bit more about it. Because see, what I feel, what I believe, before you give any exam, no matter which exam you're giving, you need to understand what's the marking criteria, what I need to do so that I can pass this exam, right? So they're expecting us to be that we are master of these 10 skills. So let's talk a bit more in detail about these 10 skills. So this is what I have copy pasted, I would say, from GMC website. So what they are expecting from us in terms of consultation, what do we understand by the term consultation? This is a big positive, this is a big negative. They want us to do this, they definitely don't want us to do this. Yes, makes sense? Right. Any question, guys? Just keep putting it in the chat box, and I hope you're able to hear me and see me. Everything is going well. Yeah, just say yes in the chat box so I know that things are fine from your side. Yeah, it's going well. Okay, perfect, perfect. So consultation. So what they want for us that it's a smooth consultation. Yeah, smooth consultation. Uh, Unstructured consultation, illogical or disordered approach, it's a big no. Smooth consultation means they want you to go in a sequence. For example, you have got presenting complaint, then you will elaborate that presenting complaint, you'll ask some associated symptoms, you'll be ruling out some important differentials, killer differential, emergency differentials. Then you have got past medical history, you've got lifestyle, personal history as well, then you have got social history, then you'll have examination, investigation, and then you'll be coming to a management plan. So it's a nice sequence, isn't it? So they do not want you to jump to the sequence. If you're jumping, what's going to happen? You'll not be able to score good marks in the exam because they don't like it. So, for example, you're taking history for a patient who's having chest pain, a typical chest pain, which is in the central going to my left arm and to my jaw. So, we know there are a lot of associated symptoms that I'm supposed to ask. So, what I did after taking the history of chest pain, I was like, yeah, family history is very important. I jumped to family history. And then I was like, no, I have to ask for shortness of breath as well. So I came back to shortness of breath. And then all of a sudden, like, oh, smoking is important. So I jumped to smoking. Then I was like, I need to ask tiredness and dizziness and sweating as well. And I came back. And then I was like, okay, no, diet is important. So I jumped to diet. So if you're jumping too much like this, they don't like it. They want you to follow a sequence. They want you to follow a sequence. So try following that sequence. That's what you mean by consultation. The second is issues. Obviously, the patient has got some issues, and that's why we are there, right? So recognize the issue. Now tell me, the patient has come to you. Are you going to do medical management first or non-medical management first? Tell me in the chat box. Medical management first for a patient or non-medical management first? When do we get the results for Plab 2? Doctor, it's usually 3 to 4 weeks time. Sometimes 3 weeks, sometimes 4 weeks. That's what happens. So, am I going to do medical first or non-medical? So, I got some answers of medical, and mostly they're saying non-medical. I would say it depends on the patient. Yes, I got Dr. Abdur saying depends on the scenario. Yes, you can't just decide just like that. I would like to do non-medical or medical first. For example, a patient is there in front of you and having saturation of 88. 85 is an asthma patient, and he's like, I can't breathe, doctor. My asthma is killing me. And what you're saying, please do not smoke, do not drink alcohol, have a good diet, be physically active. Do you think it's making sense? No, you just kill the patient in front of you. So, what treatment? Medical treatment first, that. But you will have a lot of counseling stations like diabetic and other things where you might be doing non medical treatment first. So, you cannot just decide medical, non-medical, just like that. You have to see the patient and see what is required in this particular scenario. And then I'll be able to say, yes, medical first or non-medical first. Yeah. Third is time. Time management is very important. See, guys, in this exam, they're not allowing you to carry your watches. You will not have any clock in the room as well. So the problem is 8 minutes. How I'm going to get the idea of 8 minutes? Yeah. And 8 minutes going to go like this. It sometimes feels like, oh, 8 minutes is too much. No, it's not. When you actually do the things, the station, you feel like it's just going to go just like that. So, you have got 8 minutes. So the thing is, IBS is how you're going to make the patient comfortable. But my question is, how much time for data gathering? How much time for management? Tell me. You have got 8 minutes. How much time for data gathering? How much time for management? What's your understanding on that? So tell me in the chat box. Meanwhile, I explain this. So, um, regarding the time, you have a bell system. So when you're standing outside the cubicle, you will have 1.5 minutes. After that 1.5 minutes, you will be going in the cubicle. The bell will be there and the bell says begin. Begin means you will go in the cubicle. In the cubicle, you have got 8 minutes. So in 8 minutes, what's going to happen? After 6 minutes, inside the cubicle, after 6 minutes, there will be a bell saying 2 minutes left. 2 minutes left. Right? And then there will be another bell, complete 8 minutes, which says move on to the next station. So this is how it's going to go. No watch, no clock, but you have this bell. So now my question was, how much time you're going to spend on data gathering? How much time you're going to spend on management? So I've got a couple of answers. Candidates are giving mixed reviews. So Dr. Kanzu mentioning it depends. It's 5-3. Any other opinion, guys? Any other opinion? How much time for data gathering? How much time for management? See, data gathering is 4 marks, the management is 4 marks as well. And there is a bell after 6 minutes. So what I have seen a lot of candidates, what they do is they actually spend 6 minutes in data gathering and the last 2 minutes for the management, because what they feel, the bell, say after 6 minutes, is an indicator that now you have to start the management. The thing is, it's not correct. It is not correct. You have to start your management before that bell. Otherwise, 2 minutes won't be enough. And see, data gathering for management for, so why are you giving only 2 minutes to the management? Do you think you'll be able to do the management in 2 minutes? Not possible. And management is not just like telling the management to the patient. Management is more of a two-way conversation. Management is more of involving the patient in the conversation. Management is letting the patient talk, letting the patient ask questions and answering their queries. And management is symptomatic treatment, specific treatment, non-medical treatment, medical treatment. Am I going to admit the patient? I'm going to discharge the patient, follow up, warning sign. And it won't be possible, definitely not possible in 2 minutes. So my recommendation would be 4-4. 4 for data gathering, 4 for management. Obviously, sometimes you'll see the patient is talking a lot. It might take a bit longer for you to take history, which is okay, which is absolutely fine. But I would say do not go beyond 5 minutes, 4.5 to 5 minutes in the history. If you do that, then definitely your management is going to struggle, right? So you have to be very careful on this regard. So be very careful about the time management. So whenever you're practicing with your colleagues, make sure you practice with the timer. So when you practice with the timer, you'll have understanding, okay, how much time I'm left with. So you can just do your tweak your management and data gathering accordingly. You're not asking every question, you're just asking important questions. Who's a good doctor? I always say, who's a good doctor? Who gives less medication and who asks less question, right? So that's what you need to do. Findings. Obviously, what we need to do is we are going to find some abnormal findings and results. So they'll give you some abnormal findings in the history. They'll give you some abnormal findings in the examination. They'll be giving you some abnormal findings in the investigations as well. So what you need to do, keep finding those and interpret it accordingly. Examination, yes, do the proper examination, whatever instruments they have given it to you. What you will do, make sure you handle them proficiently. For example, we have got ophthalmoscopy, we have got otoscopy as well. So do we know how to hold ophthalmoscope? Do we know how to hold otoscope? These are very important skills. So they want us to hold it properly so that we can get marks. Now the diagnosis, that's a very important thing. So what is your understanding? Will you be able to make the diagnosis in all the stations in Plab 2 exam? Answer, yes or no. Will you be able to make the diagnosis in your exam in every single scenario? So I'm getting most of the answer says no, 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 no. Okay, so then what are you gonna do? So okay, so I'm in 50, 60, 70% unable to make the diagnosis, but I got a station where I'm not able to make the diagnosis. So what I'm gonna do? The thing is, what they want you to behave like a doctor in the cubicle. No, do not behave like a medical student. So when you're sitting in your clinic, in your country, and you're not able to make the diagnosis for a patient on history taking, what do? You have definitely some differentials in your mind, isn't it? Same thing you have to do here as well. Take proper history, rule out your red flag differentials, and then when you are left with the two, three things in the end, you're not sure what's your diagnosis. So tell the patient, see, you gave me this history, you gave me this history as well. So I've got these two or three differentials in my mind. Right, I'm not sure what's going on, but definitely what I feel is something is going on from these three differentials. So what I'm going to do further investigations for you. For example, it's a chest cough short test breath scenario. I would say, so I'm going to do some blood test for you. I'll take your phlegm sample as well. I'll do a chest x-ray. And once I have the report, I'll see what I can do. And I'll be in a better position to tell you what's your diagnosis. Moreover, you said you have cough. I'm going to give you something for your cough. You mentioned you have got fever. I'm going to give you something for fever as well. Right. And then give some warning signs and safety netting points as well. So if you do that, am I going to pass the station? Of course, yes. Of course, yes. That's the thing. You can't make the diagnosis in every single scenario. Even in real life, you can't make the scenario. Even the consultants, they can't make the diagnosis in just having a chat with the patient. Sometimes you need examination, sometimes you need investigation, basic investigation, sometimes you need advanced investigations as well. Only then you can make the diagnosis, isn't it? So that's what the medical field is all about. So if you are sure about the diagnosis, fine. If you're not sure, don't panic because you have to just behave like a doctor. And what a doctor will do in that scenario, will have some differential, and you can tell it to the patient, I've got these differentials in my mind, and I'm going to do these tests. Perfect. And symptomatic treatment, right? Management. So what GMC says, a management plan, proper management plan must include follow-up and warning sign. You have to train your mind in a way that the last 30 seconds, I would say, you're going to give it to the follow-up and warning sign. You will not be able to get 4 out of 4 in your management plan if you have not covered the follow-up and warning sign part properly, right? So, and the follow-up warning sign, you can't just do it in the beginning. A lot of people ask, okay, so when I'm starting the management, can I just do follow-up and warning sign in the beginning itself and then I leave the rest of the management? What do you think? My answer is no, you can't do it. The thing is, what you need to do first? First, you need to go for only this management part, and follow up and warning sign is the last. When you are closing the consultation, then only you're going to tell you can follow up with me, and if you get this symptom, you can always come back. That is the last thing that you're going to do in the cubicle. Okay, but it is a must. A rapport. Make your patient comfortable. So how are you going to make your patient comfortable? The thing is, so there are many things that you can do to make your patient comfortable. So you want to mention anything, let me know. So how are you going to make your patient comfortable? Number one, I would say the most important thing, according to me, I would say is listen, listen, listen. The country we come from, I'll be very honest and blunt, maybe you can say, that the country we come from, most of the times, we do not listen to the patient. And the reason is why we are not able to listen to the patient, because we don't have much time in our countries, because you have to see a patient every 2 minutes. And if I start listening to the patient for everything, then it's not going to work for me. So we don't listen to the patient that much. But here in the UK, you have to see one thing. The patients, they love talking, they keep talking. And what you need to do, make sure you have got good ears. You listen. If you talk less, fine. But if you are not listening, that's not okay. So you have to listen, 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 listen. And if patient is talking too much, you can't interrupt the patient. Patient can always interrupt you, but you can't interrupt the patient. But what you can do, you have to give them active signs of listening. If they're talking, what you're gonna do? Okay, right. These are active signs of listening. It means the patient will feel like, this doctor is listening to me. He's not sleeping. He's not dozing off in between. So these are the things which is very, very important. Yeah. Another is reassurance. Somebody mentioned, yes, that is very important. So you got a station like, say, tension headache, you got a station on sinusitis, you got a station on teething for children, you got a station on night terrors, you got a station on neonatal jaundice. So there are many stations which are reassurance stations. So yes, you need to do reassurance properly. But at the same time, Dr. Deswal, make sure you're giving reassurance, but you give the warning sign properly as well. I know there's nothing to worry in it, but if you develop this symptom, it's a red flag. Make sure you come back to the hospital. So that is what you do. So reassurance, yes. Listening to the patient, yes. What else we can do in this? Another is acknowledge the patient's emotions as well. See, what's going to happen that we are taking history, and most of the time in some scenarios, you will see the patient will stop you in between and they will ask you some challenging questions. For example, the patient was having chest pain, and all of a sudden they'll stop you and they're like, doctor, is it heart attack? You're going into a nice sequence of your history, and all of a sudden this patient is like, is it heart attack? You know what our human mind will say? Yes. Oh, no, 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 no. So sometimes we say yes, sometimes we say no, because it just happened all of a sudden. Now, how can I avoid this kind of mistakes? I always say when you get these kind of challenging questions, you need to buy some time. Don't answer straight away. Right. And you don't have the answer as well because I'm in the middle of the history. I have not done my history. I have not done my examination. I don't have an investigation. How can I answer that question? So, but he asked me a question. I need to answer something. Is it heart attack? So my answer would be, I need to buy some time. I can see you are worried about heart attack. It's a genuine concern. The thing is, I have to take your history, I have to examine, I have to do some investigation, and then only I'll be able to tell you what is happening with you. When you say that thing, you have acknowledged the patient's emotions as well. And you told the patient that I need to examine, I need to take your history first, then I'll be able to do that. And you have not said yes, no, because if you say yes or no, that's not going to work in Plab 2. You have to have diplomacy. You have to be a bit diplomatic with the patient. I'm not saying to lie to the patient, no, but there's a way to say things in the exam. Plab 2 is not about what you say. Plab 2 is all about how you say things. That's what we're going to work more. You have medical knowledge to pass this exam because you've all done your platform, right? But here, how you say things is very important. Yeah. What if the patient takes all the time talking? Don't worry, doctor. See, we know we have 8 minutes. Trust me, the patient knows that you have 8 minutes. They want, when they talk, they're actually giving you important findings. They're not just talking rubbish. They are just trying to help you. They want to give you the history in one go, right? What happens if mistake the diagnosis? Is it safe to say that you fail that station? See, if you're not able to make the diagnosis, fine. But if you're giving very much wrong diagnosis, it's not okay. It's not okay at all, right? Yeah. Initially, we ask the patient to keep calm and then let some investigation to confirm it. Yeah, but you have to be very careful. Like if the patient is shouting, patient is doing anything, you can't tell the patient to calm down. What you have to do is you just have to acknowledge the patient's emotion. If patient all of a sudden asks you, is it heart attack? Emotion is his concern. I can see you are concerned about heart attack. When patient is angry and how you will reply, patient is shouting at you, you can't shout back. I know in your country you might be shouting back on the patient, but here, what you do, you acknowledge. I can see you are upset today. I can see you are angry today. So that's what we do. That's what I mean by acknowledgement. Okay. Listening is very important, guys. Yeah. Also, get some non-verbal cues as well. What do you mean by non-verbal cue? See, verbal, I'm telling you, doctor, I'm in pain. Doctor, I can't breathe. Doctor, I have nausea. Doctor, I have got fever. I'm telling you verbally. But the thing is, there are non-verbal cues as well. For example, patient is sitting, patient is talking to you, but patient is shaking her leg. That is a non-verbal cue. So whatever unusual you will see in the patient, you need to verbalize it as well. So what you have to say, I can see you're shaking your leg. Is everything all right? Is there anything I can do for you to make you more comfortable? That is what you have to do. That's what you have to do. So acknowledge anything, whatever you see. Because I know most of us, what happened is we have observed that patient is shaking the leg, but you have not said anything about it. Then how the examiner will find out that you picked that non-verbal cue? You won't be able to, right? So what you need to do, anything unusual, say it. Yeah. Me to patient, try not to worry, your condition is treatable. Yeah, doctor, but again, doctor, one thing I would say, sometimes it works, what you just wrote, it's okay. But sometimes I'll tell you, if it is a heart attack, if it is a cancer scenario, this line may not work, right? And I don't want you to give false reassurances to my patient as well. So be careful, yeah? Is it possible to jot down the details from the patient history as they are talking? I wish, doctor, but the problem is they are not giving us any pen and paper, right? In some station, yes, they give us pen and paper. For example, like in mini mental state examination, they give us pen and paper so that we can write down the scoring of the patient. Sometimes in Parkinson's, they give us the pen and paper so you can check the micrography of the patient. Sometimes what else? They pyloric stenosis. They sometimes give you the pen and paper so that you can draw it for the parents. But mostly there's no pen and paper, so you have to write down here in your head, my friend. Yeah. Do you have to say your GMC number to the examiner at the beginning of each station? Yes. And don't worry. Sometime I know, like in stress, you might just forget your GMC number as well. So no worries. So when you go for exam, they'll click your photo and they'll give you a batch number that you'll paste here, which will have your name, your GMC number as well, right? So you can just read it from there as well. So yes. Right? Language. What kind of language I'm going to talk in the exam? Of course, in English, and English which patient can understand. Do not use medical jargons. That's very important. Yeah. Next slide. See. So I told you, like, when you're standing outside the cubicle, you will be given a task and you'll have that 1.5 minute to read that task. This is the task gonna be look like, right? So the task will be divided into 5 headings, my friend. First is where you are. Second is going to be who the patient is, other information you have about the patient, what you must do, and special notes. So these are the 5 headings. Yeah. This exam isn't testing your knowledge, a puzzle to find diagnosis. It's about if we can find the red flag quick and also the communication skills and social skills. I heard usually the diagnosis is pretty clear generally. Yes, I mean, sometimes, yes, I agree. Most of the station you'll be able to find the diagnosis pretty clearly. But sometimes it's difficult. So if it is not clear for you to make the diagnosis, you can always give your differentials. They are not looking for a doctor who knows everything. They are looking for a doctor who is safe. This exam is medical, yes. This exam is communication, yes. So it's a mixture of both. Yeah. They're checking how you're communicating, how empathizing you are, how much acknowledgement you are doing, how nice you are in just making the patient feel more comfortable. That's this exam. Medical, yes. It's not like you don't have medical knowledge, you will pass. No. But I think you already have the medical knowledge because you're done with your Plab 1, isn't it? So, and they're not giving very unusual kind of scenario. They're giving you more of a common things in the exam, right? And also, right, which scenario we can escalate it to the senior. So if you're not very sure, you're an FY2, you are an intern. As an intern, I know how much we know as an intern. We know nothing, right? So you can always take the help of the seniors as well. Now, should I mention seniors in every scenario? My answer is no. So if I am sure about one thing, I will not bother my senior. But if I've got any question, I will not hesitate in involving my seniors in that scenario. That's how it is. Yeah. Any tips on what to do in a situation where you get so nervous and forget everything at the start? This may happen, so that what we can do to avoid. I'll give you a very important tip, doctor, if you come in that situation. I will have that in next of my slides. Just wait for 5 minutes, I'll answer. I have a very good answer. I'll give you a couple of things that you can do if you get stuck. I think as a human being, we will be having, all of us will have this question. Like, I'm taking history and suddenly my thought blocked. I don't know what the hell I'm going to do. Or I don't know what's my next question. So what should I do? I'll answer that. Just wait for some time. So, as I said, the question is going to be divided into 5 headings. So, these are your 5 headings. So, where you are foundation year 2 doctor, meaning FY2. Who is an FY2? FY2 is an intern, right? Your FY2 in rheumatology unit, your FY2 in GP, your FY2 in accidental and emergency, your FY2 saying psychiatry. Is it going to make any difference? Of course, yes, because the way you take history is going to be different. The way you're going to give the management is going to be different as well. For example, you got a psychiatric patient who took 50 paracetamol tablet and the task says you are FY2 in A&E. So what's your main history is going to be like? Your main history is going to be medical history, not psychiatric history. I know it's a psychiatric patient who took 50 paracetamol tablets, but my aim is to treat the patient medically. My aim is to save the life of the patient. I'm not going to ask, why did you take those tablets? I'll ask how many tablets, which tablets, when did you take it, with what did you take it, do you have any symptoms or not, any headache, any dizziness, any tummy pain, any nausea, any vomiting. These are my important questions there. But if the same task says you are FY2 in psychiatry, obviously when the patient is in psychiatry, most probably the patient is going to be medically stable. Then what I'm going to do, I will definitely take the psychiatric history. Now, if the task says you're FY2 in GP, I've seen a lot of people, they say, I'll admit you in the GP. Come on, you can't admit the patient in the GP. You can definitely send the patient to the hospital and maybe admit the patient there, but the GPs, they don't have any facilities for admission. So these are the things I mean we need to understand quite a lot. So you need to know which department you are in so that you can give the proper management plan to your patient. Who the patient is. So here what they're going to tell you, they'll tell you the name of the patient, they'll tell you the age of the patient, maybe they will tell you the presenting complaint of the patient as well, right? But nowadays, most of the patient, they have the presenting complaint like Stanley Smith, age 45, has been referred by the GP because of some problem. That's it. That's what they have got as a presenting complaint. So they're not giving much here. Other information is none. Sometimes they might give you some past medical history for this patient, but sometimes they just say no. But it doesn't matter for us. What you must do, talk to the patient, okay? Assess. What is the meaning of assess? Assessment means history and examination. History and examination, both combined means assess the patient. And discuss the management with the patient or discuss the management with the examiner. Please check the task carefully. Most of the station, we have the management with the patient only, but there are a couple of stations where they're expecting us to do the management with the examiner as well. So what you have to do, just check it properly and go accordingly. All right. Then a special note. Special note, it's special. That's why it's special note. Yeah. So read it carefully. Patient is worried, patient is angry. The main thing is, if you're not talking to the patient, you're talking to somebody else in the scenario. It's a third party scenario. You're talking to the son, you're talking to the daughter, you're talking to the father. You have to see, am I able to give the information to them or not? Because if you do not have consent from the patient, you can't give the information to anyone. That's very important. I think in our country, we give the information about the patient to the family straight away, right? But here, you can't. You can't. So if you're talking to somebody else, not the patient, please check that line if the consent has been taken or not. However, if the patient is unconscious, if the patient is confused, you don't need any consent because you can't take it. So yes, you can talk to the next to the kin and give them the information. Absolutely okay. But if the patient is competent and there is no consent, don't give any information. It's a big blunder if you do that. So be careful on it. Now, history communication skills. How you gonna be starting the station in this exam? First of all, greet them with a smiley face. God, the guy's smile will do wonders in the exam. I know inside everybody is stressed. You are crying maybe from inside, I don't know. But here, you should smile. Smile. See, there's a difference between smiling and laughing. I'm not telling you to laugh on the patient's symptoms. What I'm telling you to have a bit of smile on your face. When you have a bit of smile, what happens? The other person, the patient, will feel like, this doctor looks confident. I can trust this doctor, right? That is really important. So, smiley face, very important. In every scenario, you will introduce yourself and you will identify the patient details as well. For example, I would say, hello, I'm Ankur with the doctors. May I get your name and age, please? May I get your name and date of birth, please? That's what you need to do, right? So they'll tell their name, they'll tell their date of birth or the age as well. And then you can ask, nice to meet you. What brings you to the hospital? What brings you to the GP surgery? How can I help you today? And then they will tell you the complaints. So this is how it should go. Okay. So in history taking, if we are going in the sequence, this sequence everybody knows that we have got presenting complaint, we have got the elaboration of presenting complaint, we have got associated symptom, differential, past, personal, social history. That's how we're gonna go, right? Now tell me guys one thing. How many differential I should be ruling out? Give me a number. How many differentials in a scenario I should rule out? What is your understanding on it? Rule out differentials. How many in a station? 3, 3 to 4 max, 3, 2, 3, 4, 3, 4, 3, 4, 3, 4, 3, max 3. Okay. Now, let me tell you one thing. If your diagnosis is a red flag diagnosis, you don't need to rule out many differentials. If your diagnosis is very simple diagnosis, you need to rule out so many differentials. Let me give an example. Patient has got chest pain. And you elaborated the chest pain and you understood it is something related to heart. It looks like angina or ACS. Do you want to rule out other differentials like musculoskeletal chest pain and others? I would say no. Because your diagnosis is ACS, which is a red flag diagnosis. You have to be very quick with your history. However, if your diagnosis is very simple diagnosis, like the history, the presenting complaint is telling you, it looks like more of a musculoskeletal chest pain. Now, the diagnosis is easy, but I would say there are high chances we might fail in this station. Why? Because it's musculoskeletal chest pain and we take it very lightly and we don't rule out other differential. That is a big blunder. So if you get musculoskeletal chest pain, you need to rule out many things. You need to rule out MI, you need to rule out ACS, for example. Yeah, you need to rule out PE, you need to rule out other differentials as well. So this is how you need to go. For example, you have got subarachnoid hemorrhage. It's usually in the occipital area. You don't need to rule out many differential. But if I've got tension headache, you have to rule out so many differential. Even 2, 3 will not be enough. Yeah, this is how it is. Another thing, if you elaborate the presenting complaint nicely, you will see that you already ruled out so many differentials. So when you come to this part, differential diagnosis, you've already ruled out so many. What I mean by that, let me explain it to you with an example. Doctor, you have got a patient. Tell me, I need you guys. So you have got a patient. She is 28 years of age. It's a female patient. She has got right iliac fossa pain. Please give me your differential, guys. 28-year-old female having pain in the right iliac fossa. Give me your differentials. I'm going to write it here. I got appendicitis. Okay, I'm going to write appendicitis. Give me the another one. Another candidate wrote ectopic for myself. Okay. What else, guys? I got these two. Ectopic appendicitis done. What else? Somebody mentioned PID. Understood. What else, guys? Tell me more. Ovarian torsion. Ovarian torsion. Another candidate mentioned ovarian cyst. Understood. What else? Somebody mentioned ileitis. Okay. Ignore my spelling, guys. So another mentioned IBD. I mean, you see your Crohn's, so I just combined it. Then another candidate mentioned is the calculi pain. Got it. Any other pancreatitis? Okay. All right. I think these are the most common ones. Do you want me to include anything else or we are okay with that? Colleague, we have written doctor. Hmm. Okay, I'll write one more. Let's make it the whole 10. Yeah. IBD, we have written. Yeah. IBD is written, doctor. Number 7. Yeah. And number 10, I write UTI as well. I think that should be there, isn't it? Mid-small merge. Okay, I'll take that history as well. Fine, fine. So these are the 10 differential. I think you guys agree with me. These are the most common ones. And as we know, like Plab 2 is mostly about the most common ones. Yeah. Now, I would like you to elaborate. Doctor, I'm a young female. So I've got pain here, doctor, in the right iliac fossa. What should be your next question? Patient says, I've got pain in my right iliac fossa. What is your next question? Tell me. Duration, no. What else? Fever? No, 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 no. What is my next question? My next question is, yes, tell me more about your pain. Your aim is to let the patient talk. Always ask open question first. I know now when I said I've got pain, you have got thousands of questions running here in your head. How you will go in sequence. Because they like sequence, they don't want you to jump here and there. First question is, tell me more about pain. My answer to that is, doctor, this pain is like from last 1 day. I'm taking paracetamol, which helps little bit, but the pain is not going away. This is a dull pain. This is 5 out of 10. It started in the right iliac fossa. It is still in the right iliac fossa. It is not going anywhere. Now, anything else you want to ask me in Socrates only, in the pain history? Ask me any question if you feel like that we are missing in the pain history. Any other question, guys? Any other question? I'll come. This is not in Socrates. Don't jump. That's what I'm saying. Just stay slowly, slowly. Associated with anything, I'll come to that. Okay, so now with this much of history, I've got pain which is 5 out of 10. My pain is dull. My pain started in the right iliac fossa. It is still there, right? With this much of history, now tell me, Can it be appendicitis? Can I say it is definitely not appendicitis? Because appendicitis pain starts from the umbilicus and then it goes to the right iliac fossa. But this patient said it started in the right iliac fossa and it is still there. So what I'm trying to do, I'm not asking any question. I'm just doing Socrates. I'm just going very basic. Now, uh, can it be ovarian torsion? Can I say no to this as well? Because I said the pain is 5 out of 10. Do you think torsion pain is going to be 5 out of 10? I would say no. So that is gone as well. Now, the pain in pancreatitis, what happened is usually it's going to go to the back as well. But I said it is in the right iliac fossa only and it's not going anywhere. Right? Calculi, maybe some of you might have had calculi and you must have seen a patient on calculi. What do you think? Their pain is going to be in the right iliac fossa only? No, it is going to be from loin to groin. Plus, what is the severity of this pain like? Is it 5 out of 10? Come on, it is going to be 11 out of 10, isn't it? That's a range. So, what I did, I just did a Socrates. I'm not trying to rule out any differential as of now. And what happened? The 4 differentials, I would say, is kind of out of my list. That is what I want you to do. Now, when you will reach to the differential, you will see you have already ruled out so many. Now, after doing the elaboration of presenting complaint, what should be your next question? So, first question, which was very important, that was tell me more about your pain. That's very important. And then what you did full Socrates. Then what's the next question that you should ask now? That is anything else, anything else. So if I may have any symptom, so then we will see what could be the differential here. So anything else, like what doctors? I'm not telling you what else I have got. Now what should be your next question? Tell me. Socrates is done. Anything else? No, doctor. What should be your next question? I know a lot of things going on in your mind. Now ask me one by one. Let's see. And so that we can rule out these differential as well and we can make our diagnosis as well. So somebody asked me nausea and fever. Good, good, good. Nausea, yes, doctor. Fever, yes, doctor. I've got nausea, I have got fever. Done. So I've got nausea, I've got fever. What else you think you want to ask me? No vomiting, but nausea, yes. Do you have got any vaginal bleeding? No vaginal bleeding, doctor. No, no vaginal bleeding. What else you think you can ask? Okay. So your differentials are these UTI. So I said fever is there, so it could be UTI. So what else I can ask for UTI? Do you have any burning sensation while passing urine? My answer is no. My answer is no. Yeah. So I'm just trying to rule this out as well. Do you have any problem with your bowel, any diarrhea, any constipation? No, doctor. With one question, I'm ruling out so many. Somebody asked any vaginal discharge? Yes, doctor, I've got greenish discharge coming. Okay, so it could be this, right? Cyst and all we'll see. So vaginal discharge, elaborate that as well. Greenish, I said it's going more towards trichomoniasis. Fine, I agree with you. What else you can ask? Now you're thinking more in STI PID direction. So what you're going to do, ask me more question. Any, if it is foul smelling or not, how much is the discharge? What is the color of it? What is the consistency? If you've got any rash in the any redness, hotness in the private area, right? All those questions. Now, and then ask sexual history as well. I know sexual history somewhere you ask in the personal history. Should I ask sexual history here in the personal history or should I ask now in the beginning itself? What do you think? I need to ask it now because I know a lot of people ask me if I ask the sexual history now, am I not just going here and there in my sequence? My sequence doesn't make sense, they say. But is it logical to ask sexual history now? That's my question. I would say yes, it's definitely logical because if I don't ask sexual history now, I don't know what the hell is happening in this scenario. So I will take sexual history. And the patients that I've got multiple sexual partner, I think I know what the hell is happening. It's PID only. Now, how I'm going to rule out ectopic pregnancy. When was your last menstrual period? Doctor, 1 week ago. 1 week ago. Okay, that's fine. So is it ectopic? It's not ectopic also. Now, somebody asked midsummer's bleeding, sorry, pain. Last menstrual period 1 week ago. So I don't think so it's going there as well. So that is also ruled out. Did I rule out everything? Yes. I know ovarian cyst, you are thinking, so even if you diagnose this PID, I'm definitely going to arrange for an ultrasound scan, right? And there I'll be able to find if there is an ovarian cyst. But considering the patient has got pain plus nausea plus fever plus vaginal discharge is not going in direction of ovarian cyst, it's going more towards STI PID. If you see in total how many questions I asked for differential, I asked only 1, 2, 3 questions only. And how many differential I ruled out if you see in this scenario? 10. I just wrote 10 in front of you and I ruled these 10 out. That is what you need to do in your exam, right? I wouldn't say 3, 4. I'll rule out so many and I will not ask many questions. I'm not an intelligent doctor, but I'm a smart doctor. That's what you need to be to pass this exam. All right. I hope I was able to make my point clear what we are looking for, right? If you tell the patient that we will do an ultrasound, will they show us the ultrasound report there or not? So it depends, doctor. In most of the station, the examiner might tell you, doctor, the ultrasound scan has been scheduled for tomorrow morning or it has been scheduled for tomorrow evening. That's fine, but based on your history, you can still give your diagnosis. Right. Because even it's PID, I still want to check the tubes and everything. So I'll still be doing the ultrasound scan. So yeah, so sometimes they give you the finding, but mostly they will tell you like it's gonna take time and maybe tomorrow, day after we'll be doing it, and that's it. Yeah, perfect. Yeah, let's go ahead. Now the presenting complaint. So the presenting complaint could be pain. So if it is pain, you know what you do? You do Socrates, and you know every single question in Socrates is very important. We just so now, right? Cough and shortness of breath, what we can do OD para, right? Onset of cough, duration of cough, intensity of cough, progression of cough, if any associated symptom or any relieving or exacerbating factors. Also ask for cough if it is dry, if it is productive. If it is productive, what's the color of it? If there is any blood in it or not. So these are the main questions that you can cover. For the exam, should I be vocal about ruling out the symptoms to the examiner? No. In the exam, you are not talking to the examiner. You're talking to the patient. And you're not telling the examiner, I'm ruling out this differential, I'm ruling out that differential. No, you just ask question, my friend. You just ask question. Examiner is a consultant and they understand why you're asking that question, right? And another thing, don't just go with the script. Uh, think before asking the question to the patient. My genuine advice is and ask that question to yourself. Ask that question to yourself. See, if I ask this question, what I am going to achieve? If you're going to achieve anything, ask that question, otherwise don't. Answering the question, you don't need to talk to the patient, talk to the examiner. You're just talking to the patient only. Can we take the notes? No, doctor, there's no pen and paper. There's no pen and paper, right? Now, if the presenting complaint is fit, fall, loss of consciousness, dizziness, vertigo, so what you will do, you will take the history before, during, after. So you'll take the history in that part, right? So I just told you briefly about it. That's what you need. Now, this whole slide is covering everything about history taking. And I'll answer the question the doctor asked, if I got blank, what should I do? Let's answer that question. So what do we have to do? First thing is, when I start any station, my first question is, how can I help you? That's a very open question. Patient said, I've got pain. Patient said, I've got cough. Patient said, I've got shortness of breath. What should be my next question? Simply, tell me more about it. I know there are hundreds of questions running in my head. So how to narrow it down, how to put it in sequence? Tell me more about it. Develop a habit of listening. Patient will tell you a lot of things. Listen. What you do, make sure your full Socrates is done. If they have told you everything, it's fine. Whatever they have not told you, just ask those questions. Finish your Socrates, finish your Odipara. After that, what should be my next question? Anything else? If the patient has got any other symptom, elaborate that as well. And what should be your next question afterwards? Anything else? Keep asking anything else. Keep elaborating, keep asking anything else. Now, a point will come, patient is like, nothing. No, that's it. Now, you have got few differentials left in your mind. You feel it could be this, it could be this, it could be this. So what do? You ask some associated symptoms as a close question to confirm your diagnosis, and you will rule out some differentials which you have not ruled out earlier. For example, the scenario I gave you, when you did Socrates, you were able to rule out so many, but we were not able to rule out, say, for example, a topic. So we asked LMP 2 weeks ago, done. So that is what you will do here as well. So ask associated symptom, then rule out some differential which you have not done earlier. In these 4 or 5 questions in the beginning, you should have your diagnosis with you. If not the diagnosis, at least 2, 3 important differentials with you. You should have. That's it. Once you are done with that, it's done. It's done. That's it. Then what you do, you need to find some risk factors. Guys, do not jump to past personal social history straight away. Past personal social history is not to make the diagnosis, is only to find out the risk factors. So, Don't. So before you start the past medical history, make sure you have your diagnosis. If not the diagnosis, at least two differentials for you. That's it. If you have nothing and you're starting past medical history, you are just digging your grave, nothing else in that scenario. So you have to be very careful. Past medical history, these are the questions, previous similar episode, medical illness, medication, allergies, hospital stay, surgery, family history, smoking, alcohol, diet, physical activity, stress, drugs, sexual history, travel, occupation, living condition, driving. Come on, so many questions I've got. Am I gonna ask every single question? No. Just ask four, five, six questions. That is it. Which question, which you feel are the most important ones, right? You're gonna decide. For example, my patient has got lung cancer. From this history, I understood the history is looking like going more towards lung cancer. So what I'm going to ask from past, personal, social, I'm going to ask every question? No. I'll ask maybe previous similar episode of any hemoptysis, for example. I'll ask for family history. I'll ask for smoking. I'll ask for occupation, and that's it. That's it. I'm not going to ask these 20 questions. If I ask 20 questions, I'll just spend 2 minutes there, and when I'm going to do the management, there's no management then. So you have to be very careful out. Do you have to do examination for every history taking station, or would be specifically requested if you need to do it? So the station, history station, what is going to happen, doctor? When you enter into the room, you just check the room because sometimes they have got a mannequin. If there is a mannequin, you are expected to do the examination as well. Otherwise, you'll mention, I would like to do this examination, I would like to do that examination. And what's going to happen? The examiner might be able to give you the finding. That's what happened in this exam, right? So you may not be doing it in every station. But some station, yes, you are expected to do it as well. Okay. Now, is there anything else I should know? Patient's concerned, patient will have the concerns throughout, so make sure you keep acknowledging it. How this illness has impacted your life in general, that's very important as well. See, you're not only treating the patient medically, you're treating the patient overall, right? So that's very important. If the patient has got any chronic illness, ask the patient how it has impacted you in general. That's very important. Sometimes patients say, oh, doctor, I feel tired. It's been 3 months. And, I used to spend time with my family, with my kids. I used to help them in their homework. I used to play with them, but now I just feel tired when I get back from my work. I just feel like I need to sleep and I can't spend time with them and I really miss it. So I don't know what's happening. So this is very important. So here the patient is having medical problem, but the patient has got some social ethical problems as well. So, and our job is to treat the patient overall. Now, the question somebody asked, if I am blank, what should I do? So it can happen like you're taking history and all of a sudden you're blank. So tell me any suggestion that you guys have got. If I'm blank in my station, what should I do? What are the options that we have got? Tell me. I would like to hear your opinions. What are the options that we have got? I'm taking history, all of a sudden I'm blank. What should I do? Ice, ice, ice. Amazing. Yes. Ice. I know I've kept ice here, so do ice. Going blank is better, then you have a fresh opinion. Yes, fine, but then I can't have a blank and silent time for very long, isn't it? Because you're having a chat with the patient, all of a sudden you're silent. And patient is like, what happened, doctor? Then he will start taking your history, isn't it? So ICE is very important. ICE is what? Idea, concern, expectation. Idea. Do you have any idea what's going on with you? Are you concerned about anything in particular? Is there anything else you are expecting from today's consultation? That is your ICE. Now, a lot of people ask me where I should do ICE. My answer is you do wherever you want to do. Do you want to do it in the beginning? Do you want to do it in the middle? You want to do it in the end? It's fine. Can I do I here, C here, E here? Fine. You can do wherever you want. I somewhere else, C somewhere else, E somewhere else, that's absolutely fine. So when you get stuck, I would like you to do ICE. Do you have any idea what's going on? Sometimes, trust me, the patient might be able to help you out as well because when they come to you, they might have Googled their symptoms and they might have something in their mind. And you need to talk about that. What's their idea? What's their concern? What's their expectation from this consultation? So you might be able to get that. So do ICE. I'll tell you about one scenario. There was a case. It was MS, multiple sclerosis. And I think you'll agree with me. It's not very easy for us to make the diagnosis of MS just by taking the history. Even neurologists, they want to see the patient a couple of times, then only they'll come to the conclusion that the patient has got MS, multiple sclerosis. So the patient was having very vague history. Patient was giving some eye symptoms to us on that day. And most of the candidates, they're like, oh my God, we don't know what the hell is happening in this scenario. So I would say those were smart doctors, they were blank and they were like, what should I do? And what they did, they asked the patient, do you have any idea what is going on with you? because they're like, I know nothing, you tell me. I know nothing. So what happened is this patient said, doctor, I think I might have MS, multiple sclerosis. I was like, why you think that? Because my mom has it. She's also having the same symptoms. So I was just wondering, and that's my main concern if I'm also having the same problem. When they did that, you're like, okay, let's ask some more question about MS. Right? That's how they help you out. For example, like you're suspecting a station like say cancer. It's not very easy for us to say that you are having cancer or I'm suspecting cancer. And I've seen a lot of candidates that are quite hesitant to say that, and which is understandable. What should I do in that scenario? I would do ice. Because if a patient has got blood and cough, if they are having tiredness, if they're losing weight, if they're not enjoying their food, they're smokers, so they know they will have a suspicion of cancer as well. Okay, you tell me, a person has got hemoptysis, blood and cough for last 2 weeks. Do you think they have Googled it or not? I think yes. Us being a doctor, if you've got any problem, I think we do Google or we do chat GPT. I don't know nowadays. So we do that, isn't it? So what about the patient? Have they done it or not? I think yes. If you tell Google elderly patient blood and cough, what Google is going to tell you? Lung cancer. So they have done that research. So I know it's very difficult for you to say that you might have cancer. You don't have to do that. What you'll do, see, Stanley, you have got blood in your cough, you have got weight loss, you've got a loss of appetite, you're feeling tired these days, you're having shortness of breath as well. So, is there anything that you're concerned about? Do you have any idea what's going on with you? And he's like, doctor, I was just checking on Google. I'm just worried about cancer. What do you think, doctor? Stanley, I can see you are worried about cancer. I would like to say one thing that it is one of the possibility. And what we need to do, we need to investigate it and see what's happening with you. That's it. The life becomes easy. So that's what you do. So if you get blank, what you do ice, 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 ice. Okay. Now, let me give you an example why expectation is important or not. A lot of people ask me that if I ask this question, what are you expecting? The patient might feel awkward. No, it is not awkward question in this country, but ask it in a nice way. Sometimes we ask very bluntly, what are you expecting from me today? I mean, don't ask that thing. Ask in a genuinely nice way. For example, you have a station. Say, for example, it is tension headache scenario, tension headache. What is the management of tension headache? Just tell me. What is the management of tension headache? Can I say just get rid of tension? If you're a smoker, don't smoke. If you're drinking alcohol, don't drink alcohol. If you're not having good diet, have good diet. If you're not physically active, be physically active. That's your management of tension headache. So you got a scenario, you took the history, you ruled out all the red flags, and you come to the conclusion it's tension headache. You did the management of tension headache, and you're done with the station. You got your result. You got one in the management. I was like, why one in the management? I did everything. The thing is, you didn't fulfill my expectation. I'm like, what was your expectation? You never told me. I was like, you never asked me. Okay, so what was your expectation? So, how are you going to cover that? So, you'll tell the patient, okay, the history that you've given in the examination I have done looks like tension headache, right? And I'm going to do the management of tension headache now with you. I just want to know, do you expect anything else from this consultation? Yes, doctor. I would like to have a CT scan as well. A CT scan, and then you'll have a conversation about CT scan. That we don't do CT scan. It's not required. It's just the harmful radiation. So that's why we don't do CT scan in tension headache scenario. And what happened? How much you got? You got full 4 out of 4. So this is, I'm just trying to explain what is the importance of eyes. What is the importance of expectation? That's how you will do. So if you get blank, number one, you do ice, ice, ice. Another thing, doctor, what you can do is, see, there are many problems. Like, for example, we just was just talking about MS, multiple sclerosis. So what happened is, it can involve multiple systems as well. It can involve multiple systems as well. So what you can do systemic review as well. You can ask questions from all the systems. Any headache, any dizziness, any eye pain, any blurring of vision, any runny nose, any nausea, vomiting, any chest pain, any shortness of breath, any tummy pain, any diarrhea, any constipation, any UTI, any joint pain. That is something that you can do. It's a systemic review, asking questions from all the systems. Again, you don't have to do in every scenario. It is only done in the scenario where the diagnosis is not coming very clearly. You might think this particular illness is involving most of the systems. That's why I ask all these symptoms. All right. Or ice. Ice, ice, ice. Ice is your biggest friend in your exam. Okay. So that's your data gathering. What comes in the examination and management? So This part is the management. So after taking history, what you need to do is you mentioned about examination and initial investigation. Am I going to do the examination? Am I going to just mention it? If you enter into the room and you see there is a mannequin, you will do it. And if there is nothing, you just mention it. When you mention it, examiner might be able to give you the finding. And you mentioned about initial investigations as well before you give your diagnosis. For example, the patient, you have got a young female patient, she have got pain in the suprapubic area, she has got a burning sensation while passing urine, she has got nausea as well, she is going to the loo more often, she has got mild fever as well. What is happening? Can I say it's UTI? Yes? Now, I am kind of 80-90% sure it's UTI. So which examination I should do? I would say I would like to do your vitals and I would like to do your abdominal examination. Which investigation I should do? I'll be doing your routine blood test and I'll be doing your urine dipstick test. When you mention these things, what's going to happen? The examiner will give you a piece of paper which says vitals, temperature is slightly high, patient has got tenderness in the suprapubic area on abdominal examination. On urine test, patient has got leukocytes and nitrates in the urine sample. What is it? UTI. That is it. On the basis of your history, on the basis of your examination, on the basis of investigation, what I feel you have got a urinary tract infection. So you will explain the diagnosis, you'll disclose and explain the diagnosis, and you explain the positive examination and investigation findings as well. And what we feel you have got a urinary tract infection from our assessment, because in the history, you said you have got fever, you have got nausea, you have got pain in the tummy, you are going to the loo more often. When I examined, I found, yes, you have got fever, and in the urine sample, I found certain kinds of cells, which are nitrates and leukocytes, they were high as well. So it means you have got UTI, urinary tract infection. That's what you need to do. I think it makes sense and it's pretty simple, right? Then, if you have to do any further investigation, you can do treatment. Now, treatment is symptomatic, treatment is specific. For example, I will give something symptomatic for nausea, something symptomatic for fever as well. Specific is I'll be giving antibiotics as well, right? And before that, make sure patient is not allergic to anything. Medical treatment first or non-medical treatment first. Again, you will see the scenario. Some station, medical first. Some station, non-medical first. That's how you're gonna go. Admission, you decide. If you're sure, admit. If you're sure, discharge. If you are not sure, what should I do? Keep the patient in the hospital and involve the seniors, and they can decide if you're not able to decide. As simple as that. Follow up and warning sign, as I said, it's a must. You can't come out of the cubicle without these two things. And if you're coming out, don't expect you're going to get high score in the management. Okay. And in the end, we can offer some leaflets and pamphlets as well to our patient. So that is going to be a complete management plan. So this slide, my friend, this slide covers everything. Right. So any medicine, surgery, gynae, pediatrics, mostly it's going to be this. Treatment, you're supposed to tell which type of antibiotic, or it can be a generic antibiotic, that's it. If they ask which one, I'll give you antibiotic according to the hospital protocol. That is it. Which antibiotic doesn't matter, right? It's in the BNF, it's in the NICE guidelines, but you don't need to learn those things. In the book is that's BNF, British National Formulary. The book is going to be there in every single cubicle. So if you have got time, you can open it and let the patient know as well, or else you just say it's going to be according to the hospital protocol, and they're not bothered about it. So no worries about that. So with this slide, you understood the data gathering, you understood the management as well. Okay, now what comes under IPS? These are the most important points for IPS. Active listening. Guys, listening is very important. I'll tell you one thing. A lot of people ask me when I am, so what is the hint? Now I'm prepared for the exam. How do I know if I'm prepared for the exam or not? My simple answer to that question, when you will start listening to the patient and you're not thinking about your next question, it means you are fully prepared for your exam. When you're doing the consultation and you're thinking about your next question and you're not listening, you are in the preparation phase. Prepare more, and more. But once you start listening and you're not bothered much about your next question, it means you are prepared. As simple as that. Okay? So listen. Signposting. Once you're moving from one part of the station to the other part of the station, you can signpost it. Signposting simply means giving the heads up to the patient that this question is coming. Let me say it again. So, for example, after past medical history, you're going to the lifestyle question like smoking, alcohol. I can't ask it directly. So what I'm going to do is I'm going to say, I'm going to ask you some question about your lifestyle, your smoking, your alcohol. It might be related to your case. Tell me, do you smoke? So what I did, I just gave the heads up to the patient. So the patient will not feel very awkward when I ask this question. Otherwise, if I do like this, do you have anyone in the family having any medical problem? No, doctor. Do you smoke? Smoke. Why he asks smoking straight away? It feels very awkward, and I don't want you to do that. So that is why we can do signposting as well. Summarizing, you can do the summarization of the station in the end. What I mean by that, for example, when I mentioned that you have got UTI, then I summarized it because you have fever, you have nausea, you're going to the loo more often, and you have got pain in this part of the tummy, you have got this. So I was summarizing. That's very important as well. Can I summarize more than once? Yes, you can summarize as many as times you can. Sometime if you get blank in the station, what should I do? You can do ice. What else I should do? I can do systemic review. What else I can do? I can actually summarize the station as well. So there are many tricks or tips that we're trying to give you through this webinar. So that is something that you can do. But remember one thing, guys, if you're summarizing it again and again, what's going to happen? Time. You will be spending too much of time as well. So I won't recommend you to do it many times. I would recommend you to go for ice. But yes, in worst case scenario, maybe summarizing might be of help as well. Okay, ice. I can't stress it enough how important ice is. Ice is your best test friend for your exam. Okay, body language. The way you talk, that's one thing, but the way you behave in the room is very important as well. When you talk, we need to show that I am 100% dedicated to you for these 8 minutes. So you have to have that enthusiasm of talking to the patient, right? When you talk, the whole body should talk. Body language is very important. Don't have very dull body language. Okay, tell me more about your pain. I mean, are you interested in talking to me or not? So that is something you need to work on, right? Body language, positive body language is very, very important. Yeah. Involve the patient in the management plan. Management is not less like you just tell everything, I'm going to do this, I'm going to do that, I'm going to give you this medicine, and it's done. No, involve the patient in the management. So make a habit that I will say 3 lines, and after that, I'm going to give a pause in the management. See, data gathering, it's a two-way conversation because you're asking question, patient is answering. You're asking question, patient is answering. It's going very well. But the problem comes when it is the management time. So you have to involve the patient as well. So make sure you just don't talk throughout. You talk for 3, 4 lines, you give a pause, you let the patient ask questions. You need to involve the patient in the conversation. Check and check. When you're giving the information, give in small chunks. Don't give everything, all information in one go. You have given me the whole information. You're like, did you understand? I was like, no, I didn't. And you're like, oh my God, what should I do now? So you give the information in small chunks and then keep checking the understanding of the patient. That is very important. Yeah. Respond to the cues. You have verbal cues, respond to it. You have non-verbal cues as well, respond to that as well. And acknowledge. That's really important. Yeah. What else is important? So, trust yourself, guys. Trust yourself. When you're prepared, and before the exam, a lot of people will have one question in their mind. Do I remember what I've just read? Come on, you're a doctor. You've been reading medicine for last 6, 7, 10 years. Come on, just trust yourself. In IELTS or in OET, our instructor used to say, for English exam, you need to have complex sentence. You'll get high score. IELTS, this is not IELTS, this is not OET. I would say use smallest sentence. Make it easy for the patient to understand. And for you also, it's easy to talk in small sentences, right? Please practice in front of the mirror. It is quite helpful. It is very helpful because you have to see your facial expression, how you're going to look like, and do you feel enthusiasm in yourself or not? So you may start hating yourself when you do the practice in the mirror for a few days, but trust me, after that, you'll start loving yourself as well, right? What you can do daily basis in the beginning, you can record your consultation as well. Record your consultation and listen to it because I think you're the best critique for yourself, right? See what you liked in your consultation, see what you didn't like. See, I said this answer this way. Can I say it in a different way? Because Plab 2 is what? It's not what to say, it's how you say. So daily by daily basis, what you will see, your consultation has to be more smooth and see how can I make it more smooth. That's it. Yeah. Be strong mentally, be confident, not overconfident. There's a difference in it. Reassurance, the patient, yeah. Trust your language skills. A lot of patients, a lot of candidates, I mean, they come to me, they're like, I'm not very sure if I can talk in English pretty well. Come on, you have passed your English exam, so you're good in it. And when you practice for Plab 2 for 2 months, for example, you're talking in English only. So what happened? You will be very smooth in your languages. Be relaxed. I know it's a stressful time when you appear for any exam. But a bit of stress is good, but if it is too much, it's going to affect your performance. It shouldn't happen. So relaxed minds can do wonders. And that's why we are here for. Right? Thank you, guys. That's my introduction. I hope you liked it. I'm not sure. It is a brief introduction, I will say, because when I do it in the course, I spend usually 2.5 hours. Right here, I was able to do it in, I think, 1 hour and 10 minutes. But yeah, so I was unable to understand how to explain ice in the situation. For example, if I've gone blank, how do I apply ice here? So you're blank now, you can ask the patient, all right, John, so do you have any idea what's going on with you? So they might be able to tell you anything. Are you concerned about anything in particular, John? That is the way you can apply ice, doctor. Okay. Now, guys, I hope you enjoyed it, yeah? And if you want these slides, I'll be able to send it to you. If you can just come in the WhatsApp group, that would be great, right? Because it's easy for us to send you the slides, yeah? Now, wait for some time. Now, I'm going to tell you what we actually do in Aspire, right? So how the course is going to go. Yeah, if you've got any question, I'll be more than happy to answer. Would a month of practice be enough to give Plab to? Yes, after the course, if you've got 1 month, it's a bit tricky, but yeah, it is. Yeah, the driving DVLA, yes, that is a different guidelines, and there are many conditions like a patient had MI, patient had a stroke, patient has got cataract, so there are different guidelines on DVLA. Yeah, how long before the exam should we join the course? See, I would say join as soon as possible. Why are you delaying it too much? That's my question. Because see, now if I say this, once you book the course, till what time my course is valid? Your course is valid till you pass. So why are you delaying it? What we have, I'll tell you in this slide. So first of all, I'll just go through this slide, and then what I can do, I can answer your questions as well, because I think some of your questions will be answered if I just explain this slide. Yeah. So we do 12 days face-to-face course in the UK, and those 12 days are live telecasted as well. First of all, with proud, I say this is the only academy, Aspire Academy, who's doing the live 12 days course in person, which is live telecasted as well. There is no academy in the UK. If you have any academy, if they claim that we do, please let me know. Right? I know nobody is doing. And that's my challenge. The whole UK, the whole academy, any single academy, they just do hybrid courses. They just give you the recorded course, and they'll just say, go and just read on your own and practice on your own and do whatever you want on your own. We are the only academy who is doing the 12 days course. Right. So that is something very important. And that's the main thing I want to stress, right? Because this exam is not just about reading on your own. This is about how you practice. And in those 12 days, what we do, we practice with you guys. I just finished the course yesterday. Every candidate was able to practice 5 to 6 stations within those 12 days. And they were able to practice the same number of stations with the other tutor as well. So in one session 12 days, you were able to practice around 10 stations with the instructor, and you were able to see others practicing as well. We were able to cover more than 150 to 200 scenario practicing. So you saw the practice happening in the academy. That is the thing. That's how you will learn, right? Just recorded sessions won't help. Recorded, yes. So when you book our course, pre-recorded sessions will be given to you as well. It's not like Aspire is not having pre-recorded session. We do have. But that is something I don't even stress upon. My stress is more mainly on the face-to-face classes, mainly on the live telecast of those 12 days. So all our 12 day sessions are live telecasted as well, and you can attend it on from your convenience, from your houses, from your home itself. That's what we have. And when you come to the academy before your exam, you can attend the courses again as well. Can I attend it again? Yes. Can I attend it 2 times? Yes. Can I attend it 4 times? Yes. Can I attend only the specific classes? Yes, come on, why not? You can. And till what time my course is valid for? It is valid till you pass the exam. So why are you delaying it? So if your exam is in May, in June, in July, in August, join now. What you can do, maybe you can have a look at the recorded lectures, and you can take part in that 12 days online session, live telecast. Once you attend that, what happens is you will get the proper understanding of the exam. Now you have got the notes with you, you have got the recorded sessions, and we will be putting in a WhatsApp group as well. So you can practice with your friends. And if you're like, oh, I missed some classes, can I attend again those online sessions? Of course, attend it again. So you feel very comfortable. And when you come to the academy, you feel more than half, I'm prepared actually. And when you come here, you can attend the classes live in person as well. Some people, they're like, okay, can I skip some and attend some only? I want to attend the examination. I want to attend ethics. I want to attend counseling. I want to attend Simban only. Yes, we'll give you the schedule and you can pick and choose and attend accordingly. Right. That's the main thing, yeah. So you'll have the material as well. PDFs will be given to you. Simban session practice happens every week. The full course includes the full station mocks as well. Two mocks, full 16 stations will be included in this. Mannequin practice. Those who are staying in our building and our accommodation. Again, no academy has this facility. You have the facility of the mannequin and the practice area 24/7. I know some of you are interested in studying in the night. Come on, man, you can do it 24/7. It's your academy, my friend. Do it. Academy practice area is accessible 24/7 for our residents. Yeah. And you'll have a dedicated WhatsApp group for your batch. Post-course support, I'm going to give more importance to this. I'm coming to it. Support until you pass your course is valid till you pass your exam. And during the course, as I said, we don't teach. For teaching, I've given you recorded videos, my friend. I'm going to practice with you. We'll practice the scenarios. I'll give you a scenario. I'll be the patient, you're the doctor, and we practice it. We practice it. That is how the course should be done, right? And as I said, we are the only academy, as far as the only academy doing 12 days live in-person session. Nobody else is doing, right? They just market their course saying this, that. This is the only course which is done live 12 days, right? Ask them what are the days and how they're doing this 12, 13 days course live. When are the dates and all? They can't give it to you because they don't have any course. The courses don't exist, and that's what I want to say. Now, what are my post-course support sessions? So, post-course support, I tell you, mostly the post-course support session is the course for the other academies, I'll tell you. But for us, post-course support is an adjunct. What I mean by that, okay, so you're done with the session. Then every week, course is happening that separately. Every week in other rooms, post-course support sessions are happening as well. For example, the last week, this schedule is for the last week. Hands-on mannequin. On 8th of December, we had hands-on mannequin session where what we do, we ask, we get, you will fill a form and we know like, okay, for example, 30 students are coming for that hands-on mannequin session. We're going to divide you into 4-5 groups. Each group, 5-6 people under one instructor. And what you will do, you'll practice on the mannequins. 1 hour in this room, 1 hour in this room, 1 hour in this room, 1 hour in this room under the supervision. And it happens every week. And it's not our regular course. The regular course, all the mannequin will be covered, all the examinations will be covered. But this is an extra thing. So when you come to the academy, even the course is not happening, something else is happening as well, and you can take part in those. Then on 8th, for example, we had a spam session as well. What is spam? It's a self mocks actually, self-practice mocks assessment, and our mock instructors are there as well. So when you come to the academy in the first few days, you always struggle to find the candidates to practice with. So what we do, we'll make you sit in the one room, and in 2 hours you'll practice 10 to 12 station with 10 to 12 different people. Some of them are our mock instructors as well. So what happened is, after the end of that session, you have talked in English for 2 hours, you have done 10 to 12 stations, plus you have made 10 to 12 new friends as well, whom you can practice in the next few days. That's what we do. 9th, we have got the prescription writing session. So prescription writing obviously is going to cover in 12 days sessions as well. But this is a practice session. So what's going to happen? For example, you have got 30 people. We'll make you sit in one of the room, right? And we'll give you BNF. Everyone will get one BNF, and we'll put a station on the screen, and we will give you a prescription paper. We'll put the timer 8 minutes and you will just fill it. Once you're done with that, we'll take your paper, we'll check it, and we'll give you another station. So if you see in this picture, so everybody has got one BNF and they're writing the prescription. It is under supervision and they'll write it, and then our instructor will be checking it if there are any mistakes or not. That's happening every week again. Then we have got the teaching session. So mannequins definitely going to be covered in 12 days session. But like for example, on 10th, we had a teaching sessions as well for the mannequin. It happens every week. That's what I'm saying. For other academy, this is their course. This is not my course. This is just an adjunct. This is given to you with the course. So don't just be fooled by others like, okay, we have this. This is not course, my friend. This is post-course support. This is not course. This is post-course support, right? Then spam again, and then Simman practice. Simman practice happens every week again. That's our Simman, right? Uh, and this happens every week under the supervision of the instructor again. So, for example, your exam is next week. We'll be calling you on stage and we'll tell you, okay, this patient has got shortness of breath. 50-year-old, go and talk to this patient. And then the whole Simban station will be done. We have trolley, the monitor, the Simban, everything is going to be done in the exam way. So this happens every way, and this is what we call as post-course support. This is not our course. So when you come to the academy, you can attend the course and you can attend these post-course support sessions as well. Right. So that is how we should be preparing. In the course, what we do, practice for 12 days. And after the course, you are taking part in these sessions. So yeah, that's that you feel fully prepared for the exam. That's how it is done. So this is our hands-on mannequin session, if you see, doctor. So one instructor and 3, 4, 5 students are there in the session. This is teaching happening in the teaching area. That is not in the course again. This is just for the teaching area that happens every week. This is spam session, like you're sitting in front of each other, and after each station, you'll be changing your seat as well. So what's going to happen? You'll be able to practice 10, 12 station with 10, 12 different people. That is what our post-course spot is. Yeah. These are our course dates actually. Now, these course dates, trust me, no academy can provide you because they don't have the course dates, because they don't have the course. That's what I mean to say. All right. And if they're telling you these are the course dates, ask them, is it in person or is it just the recorded course we have to see? For me, I'm telling you, in these dates, for example, in January, our course is starting from 5th of January to 16th of January. These 12 days, I or my friend Nick Hill or our instructors will be there in person teaching you in the academy, and the course will be live telecasted as well. Again, proudly, I'm saying we are the only academy, nobody else is doing that. Okay. Then we have got the course from 26th Jan till 6th of Feb, then 16th Feb from 27th Feb, 9th March to 20th March. So we have got the whole list till the end of 2026, right? So this is how we do. We do roughly 20 courses every year, right? And with these courses, post-course support sessions are happening every week as well. How many courses I can join? As many as you like till you pass. How many this post-course support session I can attend? You want to attend as many as you want. I mean, that's you decide. No, so it depends how much time you're spending in the academy. So accordingly, you will be able to attend those sessions as well, right? So that's what I'm saying. We are the only academy doing the course. Nobody else is doing. That's the thing. So please make sure you take your decision with proper research, right? Okay, so now how I should start my preparation. So first, usually we say like most of you are not in the UK, you are in your country. So what you can do, even if exam is late, why are you starting your preparation late? Why you don't want to start it from today itself? Because you enroll today, you enroll sometime later, your course is valid till your exam. So if you join it now, you can attend our live online course maybe. That is telecast, 12 days telecast, right? So that is like starting courses starting on 5th of Jan. You can take part in that. If you join the course, you'll have the access of the material, you will have the access of recorded lectures straight away, right? And then you can attend that live online from your house and see how it is happening, and you'll be able to understand Plab 2 fully in detail. Still, a lot of doubts will be there when you read the material. Some doubts will come, this and that. But once you're done with it, you feel like, I'm prepared. So what you can do, you can read the material a bit on your own, and you can start practicing on your own with your friends that you have made on the WhatsApp, because we'll be making a WhatsApp group for you guys. So this is how you prepare, right? And then after a month, you're like, now I feel prepared, but I've got some doubts. Can I attend the course again live online? Of course, attend it again. I want to attend only few classes. Can I attend those as well? Of course, you can. Then I'm planning to come maybe in May to the academy because my exam is in June or July. Of course, then come in May and attend the course in May again, whenever, whatever, whichever date suits you, right? That's how you do. Now, see, a lot of time you'll see you are in a lot of WhatsApp group, and which is absolutely okay. I mean, I can't just stop you in doing that, right? It's absolutely okay. And you will see, you will get the notes from this person, that person, and you have got at least the notes from 20 academies. Do you think it's practically possible to read those? And please try to understand, this exam is not about reading, my friend. This exam is more of practicing. This exam is more of communication. Of course, others are marketing my course is best, fine, but they don't have even course. I don't know what course they're talking about. So read one material, not the 10 material. When you read 10 materials, when the time to come that you have to talk, you can't talk because there are too many things going on in your head. You have to be very careful when you do this. Yeah, you can't read so many materials. That's the thing. I'm not telling others have written the material in the wrong way. I'm not saying that. Everybody has written the material through NHS CK's guidelines, but you can't read everything because everybody has their own way of writing it. Everybody has their own way of presenting the cases, isn't it? There's no right or wrong way, but it's my way or their way, isn't it? So you have to be very careful. If there are 10 chefs and making a dish, it's going to be a mess. Don't do that, please. That's my only request. Sincere request to you guys, right? I've seen people attending 10 courses. I mean, I can't stop you. I'm nobody to stop you. But I think I should guide you because I want the best for you. I want you to pass this exam in first attempt. I don't want you to just give this exam again and again. Of course, you can come to the academy. Even if you, some people ask, okay, if I fail my first attempt, can I attend the academy again? Of course. Do I have to pay again? No, you don't have to pay again. As I said, you will be the Aspire student till you pass. That's absolutely okay. But why you want to come again? Why you want to attend? Why you want to read 10 notes? When the exam is more of communication. Work on your communication. It's not about what you say, as I said, it's about how you say things. Please work on it, right? So don't delay the course bookings and all. I know marketing. I'll be open. I'm marketing my course. Yes, of course, I'm marketing my course because my course is best. That's why. Because nobody has the course in the market. We are the only academy having the 12 days live session. Right. So yeah, that's and so first attend live online, and then when you'll come to the academy, you'll be able to attend. These are our dates. Whichever suits you, you can attend. That's absolutely fine, guys. Right now, I've got some coupons as well for you, and yeah. So these are our. If you have got any doubts regarding our course, these are the informations. I've got some coupons to share with you guys. I'll tell you our discount coupon. Just give me a sec. Let me just take your questions quickly. Shall I attend online and offline later? Please suggest planning for June. So your exam is in June. You can attend our live online session as soon as possible, as I said, in January or February. So start preparing from today. Why are you delaying it? Yeah. Course is how long, please? Course is 12 days, doctor, but you can attend the course 2 or 3 times as well. Okay. Will it be of any help if I come to Aspire before in-person course begins on January 5th? My exam is in February 7th. Yeah, of course. So when you come before, what's going to happen? You'll be able to come in contact with other students as well. There is a lot of people staying in the Christmas, New Year time as well. You'll be able to make friends and you'll start practicing with them. And if you're staying in our hotels, you'll have the access 24/7. Yeah. Your offline classes are in Manchester. We're in Blackpool, Doctor. Blackpool is like an hour from Manchester. So it's Blackpool, Promenade, Blackpool. April batch, 12 days offline. How to join, please? So you simply just online, you can just book the course. And if, for example, you have booked for some other dates and now you want to change it, how can I change it? No problem. Just email us to this info@aspiretoclub.com and we will be able to help you out. As simple as that. Nothing to be worried about. Okay, we'll change your batch. How long do persons usually take to prepare for Plab 2? How many months? See, doctor, it depends. Are you working or not? If you're not working, your only thing is Plab 2. So after the course, I recommend you to have at least 2 months. If you're working as well, then it's 3 to 4 months. That's how it is. Yeah. How many people on average attend each course offering? What's the max capacity? So it depends, doctor. Nowadays, a lot of people are attending online, right? So in the academy, I would say mostly it's 25, 30, 35 some. This last batch I did it, I think there was 25% in the academy in person, and there were, I think, 15, 20 online as well. So this is how it is. Yeah. Ideally, how long does one take to prepare for Plab 2 or someone who is above average? So as I said, after the course, 6 to 8 weeks, and if you're not working, if you're working, double it. Yeah. Academy is in Blackpool, doctor. It's an hour from Manchester. Yeah. How many times do you do the 12 days course? We do 20 times in a year, doctor. And the dates I have just shared it. These are the dates. Yeah. Can you tell us more about the pre-recorded session? So yes, the when you join our full course, the pre-recorded session is included in it. So it's around 50 hours, 55 hours session, and it's a pre-recorded. I have recorded most of it, and Nikhil has recorded some of it. So you'll get the access of it, and you can see that whenever you have time at your own convenience from your house, right? And if you want to join only a recorded session, you can do that. It's £99 only. But I would recommend you to do everything because recorded is not 100% like you will understand what Plapti is. But when you see others practicing, when you practice yourself on stage with the tutor, then you'll understand it. Yeah. Is it date specific? You mean the recorded? Recorded is not date specific, but the live sessions, of course, it's date specific. These are the dates for 2026. Yeah. Can you please share the pricing of online? I'm coming to it. I'm planning to book in April. Can I book the course now? Of course, I would advise you to book the course now. If your exam is in April or May, book it now. Start preparing. Attend our Omicron 5 batch that is starting on 5th of January. That is what I want you to do. Could you kindly provide information on the accommodation, what's provided? So see, we have got accommodation. We have got 65 rooms in our accommodation, and we have got single room, we have got double room, we have got triple room, we have got a sea facing room, we have got other simple rooms as well. And the facilities you'll have like a bed, you'll have pillow, you'll have the duvet, you'll have the heating facility. Downstairs, you have got the kitchen facilities as well. What else you need? I mean, you have got the washing facility. I think that's it. That's what you need, isn't it? So all these facilities are there in the accommodation. Yeah. If I couldn't join the online lectures due to personal issue, will you be providing the recording? Recorded lectures are there. Yes, that's what I'm saying. Not the recording of 12 days session, but we have got the separate recorded session as well. And you will be given the recording for those sessions. And also, so you attended 12 days live online session, you missed 5 days. Can I attend those 5 days in the next batch? Of course, you can. That's the main thing. Yeah. How many mannequin questions will come for the exam? Roughly 2 to 3 mannequin examination station plus one sim man. So in total, 3 to 4, doctor. Do we need to pay separately for the course and the post-course support? No, 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 no. It is one course. That's what I'm trying to say. Course and post-course support course. It is included in the same package. Yeah. Link for the WhatsApp group. Okay, let me share the link. This is the link, doctor. If you can just scan it, you'll be able to come in the WhatsApp group. Do the post-course sessions are included in this long course package? Yes, that's what I'm trying to say. Yes, yes, yes. And for other academy, this is the course they have got. But I will have that also post-course support session, and it is a part of it. You don't have to pay separately for it. Right. After joining the course, is it okay if you travel to the UK 3 to 4 weeks before the exam? Yes, yes, of course. So I mean, it depends. If you feel fully prepared after attending the live online session and you're coming to the UK 4 weeks before, it's fine. 4 weeks, can I attend the course again in person in the academy? Yes. So if you feel I'm prepared and I have attended this session before online, so you may be able to pick and choose. You feel like, mannequin class I want to attend. I want to attend Simban class only. So you can pick and choose what you want to attend, what you can miss. And 4 weeks should be fine. Yeah. I only joined the full online face-to-face course. Where should I start studying? I have so much content that I don't know where to start. So first of all, just follow one content. If you have attended our academy, just follow Aspire, not somebody else. Now, what you do, you make a group, 3 to 4 candidates in one batch. That's what you do. And make a plan that, okay, tomorrow I'm going to practice these first 5, 7 history station from medicine, then first 5 counseling, first 5 ethical, some examination 2 or 3, and these 2 Sigma and these 2 prescription. Just take 20, 30 stations, right? And then you read those quickly in the night and see the videos if needed from the pre-recorded lecture. And the next day you practice those 20, 30 stations with your friends. Right? Do that for 10, 12 days. You feel like, yeah, I'm done with everything. I've done everything. I've read everything. I've studied everything. I've seen the video of everything. I practice everything as well in 2 weeks' time. That's amazing. That's how we need to prepare. Okay. How do I plan to attend online session when my exam is in April? So you can attend as soon as possible. I would say attend in January, attend in February, as soon as possible. So when you do that, you'll have the better understanding of Plab. I know most of you are working as well. So if you're working and you have attended the session, you feel prepared, right? And out of 12 days, if you're able to attend in January, say only 6 days, then next 6 days you can attend in the next batch. That's how it should be done. Yeah. Is post-course session for a fee? No, it's free for our full course candidate. It's free, it's free, it's free. Is it live or recorded? Both. We have recorded sessions. We have got live online sessions as well, 12 days. Is 1 month is enough? After the course, 1 month, maybe, if you are, if you're spending 1 month in the academy, after you have attended live online course, it should be fine. 2 months, definitely okay. We are in Blackpool, guys. I have to go. Where will the coupon be shared? I'm sharing the coupons. Okay, let me show you the coupons. Okay, so this is the coupon. Aspire X MES 2025. So, guys, our course price is £649. Okay, I'll tell you, £649. If you are a group of 5, you'll get £100 discount and it'll become £549. If you are a clubbable subscriber, still you will be able to get it in £549. If you are both, you'll be able to get it in £529. That's the thing. Now, if as Christmas, New Year is just there, so this coupon, if you put it, You will be able to avail this course with 529 pounds. If you are Plab subscriber, your group of five, it doesn't matter. And this coupon is going to be valid for the next 1 week till Christmas, 2026 till 26. It's valid. So you don't need group of five. You don't need a Plab subscriber. Just put this coupon during the checkout, and your course is going to be 529 pounds. Okay, that's the offer that we are giving it. Right, and after that, of course, this coupon will not work. But if you're a group of five or a Plab subscriber, still you'll be able to get the course in 549 pounds. Right, so Aspire Xmas 2025. That's the coupon. Right. Any question, just come in the WhatsApp group, guys. This is the WhatsApp. I'm going to share this PDF as well if you are in the WhatsApp group. Yeah. Okay. So how many hours in a day for the 12 days face-to-face session? So we start at 10, we finish at 5, 6 doctors. So 7 to 8 hours a day. Rough guidelines, cost for the course and accommodation. So course, I just said, if you just join it now, so it's 529 doctor, right? In 529, what I'm going to get? You will get recorded course. You'll get our material. You will be able to attend live online 12 days session. How many times? As many times as you want. You will be able to attend live in-person 12 days session as well. How many times? How many times you want to attend. Then you will be able to get 2 mocks as well. 2 mocks, full 16 stations. Plus post-course support session. How many I'll be able to attend? You decide. I'm not going to decide. Do I have to pay extra for post-course? No, 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 no. Right. Now, regarding the accommodation, our accommodation starts from 18 pounds per night and it is still 30 pounds. So it's a single room, double room, what kind of room you want. It depends on that. So we have got our website. If you just go there in this website, www.ankleaspirelettings.com, you'll be able to see all these things. And if you come in our WhatsApp group, we'll be able to tell you everything regarding that, right? We'll be able to share the links and everything with you. Okay. Could you suggest how to use the recorded videos and study material? So uh, so what you do is see the recorded video, say for the introduction for an hour, and read the material. Then if you're watching the cardiology video, so see the cardiology video and then read the cardiology content from the notes. Just do this. Don't just see all the videos in one go and then you'll open the notes. No, mix it up. That's how it is done. And we have got 24/7 facility, guys. Those who are in our hotel, they will be having the mannequin facility 24/7. If I book now, can I decide which date to join the live class? Of course, you will decide only, yes, yes. And how you will be able to let us know which batch I'm attending online or live in person, how you're going to give me the access. You just email us to info@aspire2plab.com and we'll be able to put you in that batch. Not a problem. I want to give my exam in July. Can I book now? Of course, yes. Also, will they release seats for Plab 2 July in the coming months? Of course, they will. I mean, now what they're doing is they are not just opening the dates in one go. What they're doing is they're opening the doors slowly, slowly. So yes, of course, they will. Thanks for the clarification. Yeah. May I ask, do you recommend also watching Geeky Medics video or is it Aspire sufficient? I would say it's sufficient. I mean, you can watch anything. I can't stop you, right? But I wouldn't recommend and I don't want you to just go anywhere else. Just Aspire is enough. You will have enough content to pass this exam in Aspire. Okay. Why aspire to choose doctor? When exam is all about practice, I can book anywhere and practice. That's fine. You can book any course and practice there. But are you doing the right practice? That's the thing. So that's why you'll be practicing in our 12 days session. And in these 12 days now, what we are doing will make you patient as well. I'll prepare you. This is what you need to do as a patient. So last batch, I just finished yesterday. So there were at least, I would say, 20 candidates. They got the chance to become a patient as well. And this is how we practiced. So that is very important. So before you start practicing, you should know how to practice. What is wrong, what's right. That's why the course is important, right? My exam is the 1st of April. Can I book now? And if I took full subscription, can I get the access face-to-face and online both? Yes, 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 yes. You'll get the access for both. Live, recorded, in person. Yes, yes, yes. Where will we get the recording of this session? If you come in the WhatsApp group, Doctor, I'll be able to share the link maybe by tonight or tomorrow morning. Hopefully by tonight we'll be able to share you the link for this recording. Yeah. By when can I book this with this coupon? So it's valid till Boxing Day, my friend. Shopping time, Boxing Day. It's valid till Boxing Day. Yeah. So please, please aspire Xmas 2025. Are mocks included in the course? Yes, doctor. 2 mocks included. 2 mocks included. And if you want more mocks, That's absolutely fine. You can book it. And it's a £60 extra for third mock. Two mocks are included. Yeah. What about the notes? Yes. So when you book the course, notes will be given. The PDFs will be, you will be able to access the PDF through the system itself. And you can download those PDFs as well. So updated PDFs will be there every time, every 2, 3 months, we just update them. Yeah. And the new station PDF is updated every month. Once we join the course, we can get access to all study material immediately. Yes, yes, yes. Immediately you will have the access. Is the accommodation fee included? No, it's a separate doctor. It's a course fee only. Accommodation, as I said, it's 18 to 30 pounds per night, depending on how many days you want to stay, right? Cost of accommodation, I told you, any discount on those? There's no discount on the accommodation, doctor, because we have already given it in subsidized rate. So if you see, our main rooms are 20, 22 pounds. So if you see for a month, it's around 600 to 700 pounds a month. It's very difficult in UK to get the accommodation in that price, isn't it? So I don't think so we can go beyond that, right? What is the coupon code? This is the coupon code. Doctor, can the mocks be done online? No, it's in person, doctor. Mocks can't be done online because the exam is in person. Can you do exam online? No. So that's why the mocks cannot be done online. Is there a coupon code for accommodation? No, doctor. It's only for the course. Study planner, yeah, and also like yes, soon I'll be having another webinar. Those who will book the course and all will have another webinar, and I'll update you on the study planner as well, a bit more in detail. I know some of you asked me question, how should I be preparing and all. So don't worry, how you should be able to prepare. I'll be able to tell you a bit more in detail. I need an hour to explain that, so I'll have a separate webinar maybe in the first week of Jan for you guys. Yeah. So the coupon code is, yes, this is Aspire Xmas 2025. Yeah. Can I choose roommates? See, I mean, how can you choose? So if you are like, say, for example, you're two-person and you want a double room, then of course you can choose. But otherwise, we will be able to put you accordingly. I mean, whichever room is available. But if you're two-person and you want, like, we two want the one double room, we can accommodate that. That should be fine. Right. Thank you so much for explaining, doctor. To those who are confused to take the course, I would highly recommend to buy this course without a second thought, as I attended the live course even before booking my Plab tour, and it was very good. Ah, Dr. Aaron, thank you so much. Thank you so much. Yes. And I think, doctor, you mentioned that you attended online, take the course. I attended the live course. I'm not sure, Dr. Aaron, did you attend online or live? So, I mean, online from your home or from the academy. So this is how we do. And you must have seen like so many stations we have practiced, maybe 150 to 200 stations we practiced. Yeah. Have you got any material for Press 3 exam, as it is the same exam as Club 2 for Ireland, but they have a data interpretation component for the exam if it is separate? I mean, we don't do that. We're planning to do that soon, and you will see something regarding Press 3 on our website soon, but not at the moment, doctor. Coupon code is it valid till today? We were thinking to make it valid till today, but then it's Christmas time. Yeah, so it's valid till 26th, doctor, till 26th. So next 6 days, it's gonna be valid. When are the mocks held? So you the mocks, you will be able to do 2, 3 weeks before your exam. 1 to 3 weeks before your exam. Because after the course, you are to do the mocks, it may not make sense, isn't it? So you should have some time. So that's how it is. Thank you so much, doctor. You explained everything very clearly. Thank you. Thank you, doctor. If we join the course now, can we join in person as well later? Yes, yes, yes. And we don't have to pay extra. I know this question comes like, how can they allow me to attend again and again? Do I have to pay extra? No, you don't have to pay extra. If you attend live online now, and whenever you come in person, you will be able to attend again and again without paying any extra charge. How can we prepare online, like with the pre-recorded videos and notes together? So that's what I'm saying. So first, once you attended live online session, you will get full preparation. I mean, the way you should be preparing from our side in the 12 days, we will be explaining. Then, if you just going through the recording, so you can see the recorded videos for an hour, whatever was explained in that, read the material for that, and then you practice with your friends online, maybe till you before you come to the academy for practice. That's how you will do it. Validity for coupon, it's valid till 26, doctor. Shared reference video in WhatsApp group, step-by-step guide. Okay. Our post-course sessions streamed online too. No, it's I mean, it's a hands-on mannequin. So it's a, I mean, in a small groups. That's not telecasted, obviously. No, no, no. It is in person. Yeah. Merry Christmas and keep aspiring us. Thank you. What if you are a member more than five members? Can we get more discount? Okay. So it depends how many you are. If it is 10, 15, 20, please come in the WhatsApp group and you will see the admin. So just message any of the admin and we will be able to help you out separately. So we will be able to help you out. Maybe if possible, we will be able to share some extra coupons as well with you guys. It depends how many you are. If you are 10, 20, 50, how many of you are there? So yes. But yes, it's possible to get some extra discount as well. Yeah. All right. Anything else? I've got some FAQs. I think I've already answered all of these, right? Any question, just let me know. And this is your QR code, guys. If you are not in the WhatsApp group, please come. Another thing, guys, if you're here, just wait. One more thing. You know, the news station, I am nowadays putting it on my Instagram as well. So please join me on the Instagram. So if you just type, I think everybody is using Instagram now. Yeah. So we have started putting news station on the Instagram now. So just try finding me, Dr. Garg, Dr. Ankur Garg on Instagram and join me there. And you'll see I always have some questions on the poll. I ask some question to the candidates on the poll so you can answer. It's a good way of learning. I mean, I know everybody is using Instagram Reels. So that's fine. I mean, you can't just avoid these things. So, but it's good if you spend 4 or 5 minutes on our Insta channel as well. So you'll see I always post like two videos, one face video and then one explaining something, just like 30-second video. And I always put one or two polls there as well. So I think that might be quite helpful as well for you guys. Yeah. So it's, I'll just type it Dr. Ankur Garg. Yeah, that's my ID. Sorry, if you just join me there and you can see like the previously, there are many topics I have explained it there. And I usually follow those carousels as well. So you can just note those things down as well. And that's my personal channel. If you want to join our Aspire. So we have got the channel by the name Aspire to Education as well. Yeah. So you can join both these channels. Yeah. And if you attended this course and you liked it, maybe you have taken some pictures, tag us on Instagram on my channel, Dr. Ankur Garg, or you can tag us at Aspire to Education as well, right? So we've got two channels. You can tag us on both, right? So that's a good way of learning as well. I mean, if you would like, you can do that, right? Okay, so what else? Any more questions you have got? Tell me. I've already asked a question in the poll. Let's see if you know the answer. The question is, what is the definition of recurrent UTI for adults? And I put four options there. And I would like you guys to answer that in poll, and you will have the answer in the next 20 hours, right? So, yeah, I just put that poll like 2, 3 hours ago. So, and yeah, just join me there, and you will enjoy the videos that we have on the daily basis. So, that's quite helpful, I feel. Yeah, because I think you can give me 4 or 5 minutes daily and just have a look at that video. All right. Are any scenarios repeated in the main exam? Yes, don't worry. Whatever is going to come in your exam will be covered in the course, my friend. So you will not have any trouble in the exam. Okay. How Aspire is different from other academies? Aspire is the only academy doing the course. No other academy is doing the course. I think this is enough, isn't it? And the new stations webinar we keep on doing so that we can keep you guys updated. That's the main thing. And you will see our material. We keep on updating the material as like very quickly so that it's going to be easy for you. So you will not have any trouble in the exam. Link for the WhatsApp group. So I'll tell my admin. So if they can just send the WhatsApp group, CJ, if you can just send the WhatsApp group in the chat as well. And I'm sharing the QR code as well, doctor. If you can just join that QR code, join through that QR code, that will be quite helpful. Right, guys. What else? Yep. Okay. Any other where the academy is located? So we're in Blackpool, doctor. So it's like an hour from Manchester. Yeah. Will this plan expire before our results are out after the exam? So no. So as I said, you have the access till you pass your exam. Okay, you'll have the access. So if you're able to pass, like for example, you gave it to one attempt, you're not able to pass. So don't worry, you will have the access again as well. Can we get the hard copy of the notes? So nowadays we have stopped giving hard copies, but we're gonna give you PDF. If you're a print on your own, you can do it in your country and then bring it. That's absolutely okay. And why we have done that? There's a reason behind it because hmm, we update our material quite often. So I mean, it's not possible for us to print it accordingly because in this country, in the UK, things takes time. It takes time. It takes quite a long time, and then till the time it comes, what happens is the things are already updated. So we don't want to print things and give you the old material because it may not make sense. So that is the main thing. Yeah. When and where I'll be able to get the recording of this webinar. So you come in the WhatsApp groups or to this WhatsApp group, the QR code that I'm sharing and the link I've shared in the chat as well. So if you come in that group, we'll be able to share the link for this recording as well. I'm in the group that says Aspire group. Is that the WhatsApp group you're advertising? Yeah, I think this one, I'm not sure. So the name of the group is Plabable Aspire UKMLA 2026. If you are in that one, yes, that is the one. Right. When will further information be shared for press 3 we're looking into? Will it be shared before June 26th? Yes, of course, doctor, before that, yes. The study material do include how to answer questions and everything. Yes, yes, it's going to be like a theory. It's going to be like a proper doctor-patient conversation. You will see that. Obviously, I don't want you to follow the script, but it'll just give you an idea how to practice with your friends. Yeah. Okay, so any more questions, guys? Any more questions? And don't forget to use the coupon, guys. And don't delay your preparation, I would say. Just start it as soon as possible. Start preparing as soon as possible. Now, as I said, you don't need a group till 26. After that, you'll be needing the group of 5 as well, right? Any trouble, anything, just put the message in the WhatsApp group. Put the message in the WhatsApp group, and our team will be able to help you out with all your queries. Yeah. So, yep, 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 yep. Any more questions? So, anybody who's booking the course now, do they repeat old case scenario in the real exam? Yes, they do that. They do that, and I'll tell you, like sometimes they make little changes. We'll be able to update you on those changes as well. I've sent requests and waiting for me to be accepted. Okay, we will accept you soon, doctor. So don't worry about that. Don't worry about that. Yeah. So this coupon extra discount for a guy with all three Plabable, 5 guys and before 26. Do you want to book it now, doctor? If you want to book it now, let me know. I may be able to do something for you. Those who want to book now. So you said you have 5 guys. You're 5 person. Okay. And Plabable people. Okay. You know, book it now. Let me know now. If you want to book it now in the next 5 minutes, I might be able to do something. Let me know. Extra discount. Okay. We have more than more than 5 members. Can we message them in the WhatsApp for additional discount? Yes, of course. Which one is the official WhatsApp group? So the name of this WhatsApp group is Dr. Plabable Aspire UKMLA 2026. And this link will take you there. This QR code will take you there. Okay. Okay. Now, yes. So, doctor, tell me, 5 guys, Dr. Shashank Dwivedi. So, what I can have for you? You have two options you can choose. If they're 5 person, want to book it now in the next 10 minutes, I will give you two options. Number one, you can get a BLS certificate and a free audiobook, both of them free. Or I can give you additional 20 pounds off, and all 5 of you will be able to book in 509. Now, if you're in a book, I can give an extra separate coupon that will be only given to 5 candidates that you have got. Now, you can decide either you can have the access of audiobook and BLS both, or additional 20 pounds so you can book the course in 509. You can decide. Anyone can avail this discount. I'll be there for the next 5 minutes if anyone is interested. And you can have a word with the team in the WhatsApp group as well. If you're able to book the course today itself, in the next, say, 10 minutes, 15 minutes, they can facilitate that coupon for you. Or if you don't need the coupon, you want a free audiobook. Because nowadays, I think podcasts, audiobooks are quite famous, isn't it? So we have got the audiobook for ethical scenarios as well. So we can give you that free of cost and a BLS certificate as well. If you are a group of 5 Plab subscriber and want to book it today. Okay, so that is it, guys, from my side. And the group can be quite helpful if you, I mean, if you are in the WhatsApp group, you can make your own group as well, the group of 5 and all, right? Okay, so right, and please, guys, as I said, join me on Instagram, dr.ankur.garg, aspire to education. So you're going to do two Instagram groups as well, Instagram channels, and you will see we post something that is going to be useful for you. Some latest scenarios I always share there, and you'll see like it's. I started putting these material from last 1 month only. Now I used to put it before as well, but not like frequent, not like daily. But now you'll see daily 2 videos from my side and lots of other material there, right? Uh, uh, uh. What is the price for only the online classes? So if you want to attend only the live online 12 days session, only once the access will be given, and the price is £99, doctor. Yes. If you book in group, does it mean we must attend the same day? No, no, no. If you book in group, you can attend whichever course you want, doesn't matter, right? If you book in group of 5, your friend is attending once, you can attend it twice, your other friend can attend 3 times, 4 times, whichever batch, doesn't matter. Okay. Is it 500 GBP per person for everyone in the group? It is going to be 509, doctor. 509 if you book it now. That's the thing, in the next 10, 15 minutes. Then we can do it. Otherwise, 529 with this coupon on your screen. Right. So, and please join us for our Instagram as well. As I said, so we have got 2 channels. One is Dr.Ankur. Another is Aspire to Education. Please join, please. Can someone ping me on the WhatsApp who wants to enroll now? So don't worry, guys. You can make the group in the WhatsApp itself. In our WhatsApp group, you can make the group inside it if you would like. Yep. Okay. So I think somebody has taken the initiative. Yeah. Please fill in the details for the group of 10. Okay, you want a group of 10? Okay, that's fine. Okay. Right, guys. So, any query, just come in the WhatsApp group. That's the link here. Right. So I'll just complete this group. Okay. Okay. Right. So is there any group of 5 minimum, those who want to do it? Aspire to Education is WhatsApp group or Instagram? See, Instagram group is this one. The QR code, sorry, the WhatsApp group is, I'm showing this QR code, right? That's your WhatsApp group. And I was saying you can join us on Instagram as well because we do share lots of teaching content there. And we've got 2 Instagram channels. One is Dr.Ankur Garg. Another is Aspire to Education. So these are 2 Instagram handles that we have got. Regarding the WhatsApp, our WhatsApp group that we are advertising in, the name is Plabable Aspire UKMLA 2026, right? And you will be going to that channel once you will scan this QR code that I'm showing you on the screen. Sorry. So I'm just telling it to my admin. So CJ, do one thing. If there is a group of 5 now, Just ask them if they want a BLS and audiobook and they want a book course in 529. If they don't want these two things and they want additional 20 pounds off, so we can give them the course in 509 and you can send them the coupon separately on their respected emails. Right? So yes, in the group, our team is there and they will be able to assist you guys. Right. So, any more questions for me? Anything that I can help you out? So, and as I said, you can, I mean, obviously, I know a lot of you will be doing your research before joining any academy. It's entirely up to you, and that's understandable. But again, I'm saying what makes us different from others because we are the only academy doing this session live in person 12 days. Nobody else is doing. They're doing something hybrid courses and all this and that. And they might say, okay, you can join the recorded course in 200 pounds. When you come to the academy, you'll pay extra this, extra this. For us, you join the course once and everything is included in it. That's what we want. And I know somebody asked me if I want to attend only the recorded session, if I want to attend only the live online session, is it possible? Yes, it is possible. It's in 99 pounds. You can do that. But then you'll get the access only once. For a full batch candidates, you'll have the access multiple times. Yeah. When are you posting this Zoom on WhatsApp for us? Hopefully by the end of today. End of today, you will be having it, doctor. End of today. Right.